Who's the judge? But so if we don't.
Okay. I don't know. I'll look at Mrs. Fraser, sorry. I'm sorry, he is coming in? He is. Okay. Mrs. Fraser?
Yes.
We are live on YouTube. You have your whole committee, but for Ms. Hogan.
Okay, we can get started then.
Yep.
Okay, thank you.
Right.
Okay, I'd like to call the March Services Committee to order, please. And the first thing we need to do is approve the minutes of last month, February the 22nd meeting. So if someone would like to make that motion. And if you
I'll make the motion. This is Peter.
Thank you, Peter. And a second to that, please.
Mr. Conover?
Mr. Conover, thank you. It's a little difficult to see behind this plexiglass. All right, any additions or corrections to the minutes? All right, we'll vote on that. All those in favor?
Aye.
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 Oh, can't do that. All right, thank you. So then I'm looking for Rob. He must be there, right?
Yes.
Okay.
Here.
Go ahead, take it away, sir.
Okay, good morning, everyone. Just have one resolution request and then a couple of informational items.
Okay.
I have a resolution request to present for an appointment to the Warren County Community Services Board. A request to appoint Chris Hanchett to fill an unexpired term that will run the term was running January 1, 2018 through December 31st of 2021 on the Warren County Community Services Board. This is a vacancy that was created by resignation of Maureen Schmidt. So we do like to have our DSS commissioner as part of our Warren County Community Services Board.
Nope, makes sense. So would someone like to make a motion to approve that request?
I will.
Mr. Conover, second.
Second.
Mr. Strauss?
Yeah.
Any discussion? All right, and we'll vote. All those in favor?
Aye.
Aye.
Opposed? Carried. Thank you.
Okay, just a note, I did notice on my resolution request that there was a misspelling of Chris's name. So on the actual request, Christian, obviously T-I-A-N, Christian Hanchett.
Okay, thank you.
My apologies about that. Just a couple of informational items. I did want to update the committee on our, there had been 20% state aid withholds for the last 3 quarters on our funding. And I'm happy to report that we do now have restoration of those 20% reductions. We had seen those in the 3rd and 4th quarter of 2020 and the 1st quarter of 2021, but that funding has now been restored, and we're in the process of updating 2020 contracts to be able to pass that funding through back to the agencies.
Great, thank you.
Yep. And then I just also wanted to mention in terms of the governor's proposed 21-22 budget, a couple of things we're keeping an eye on. There is a 5% permanent cut to state aid, to our state aid proposed there. Obviously we don't want to see a 5% permanent cut going forward. Governor's budget was, I think, based on, tentative based on receipt of federal funding. And so maybe with the federal stimulus, including state and local governments, that maybe this will not stand in the budget. In fact, I did receive another analysis that showed the legislature's one House budget proposals, and both the Senate and Assembly did reject that in their one House budget bills. Also, there was a proposed 50% reduction in jail-based addiction treatment and transition services. Warren County receives $60,000 in funding for this purpose. So that was proposed to be reduced to 30,000. But again, also in the Senate and Assembly one House bills, that reduction was rejected. So we'll just have to see how the budget process plays out. But those, I just wanted to make the committee aware. Those are a couple of things we are keeping an eye on.
Thank you, Rob. We appreciate that. All right, we have no referrals or pending items, privilege of the floor. Any committee member that has any comment that they wish to make or any questions? All right. Don, do we have anything out there on YouTube?
Morning, Chairwoman Frazier. There is no comment on YouTube right now.
All right, thank you very much. All right, thank you, Rob. We'll see you next month.
Okay, thank you very much.
You're welcome. All right, we'll then move on to Office of the Aging. And Dee, I'll turn it over to you. Yeah. Okay. Dee, can you hear us? We're all set.
Can you hear me now?
Now we can, yes, thank you.
Okay, sorry about that.
Okay.
So the only action item I have is permission to enter into a memorandum of understanding with the Warren County Public Health Department for assistance with answering our phones and registering seniors for the COVID vaccine. We are going to do this with our New York Connects ADRC stimulus funding in the amount of $20,269. This is all 100% funded. There is no county match required.
Okay, I think this is wonderful, and you've been certainly very helpful to public health, Dee, and we appreciate that. So would someone like to make that motion to enter to that MOU?
Yeah, Judge
I'll
Stroud
move
will
it.
make that motion.
Mr. Stroud?
I'll second it. This is Peter.
Mr. McDevitt, any discussion? All right, all those in favor?
Aye.
Opposed? Thank you. Carried. D, vacant positions, food service manager and service specialist.
Yes, so we had 2 resignations this month, and I was hoping to be able to bring them forward to request permission to fill them, but they're still with the Civil Service and the Human Resources Department for approval. We are looking to amend the titles before we actually request to fill them. So I just wanted to make you aware that we had the 2 resignations, and they were looking to tweak the positions a little bit to better suit what these individuals are doing in the positions.
All right, thank you. And we'll be working on that. We have no referrals or pending items. Anyone on the committee or in the room here who has a comment they'd like to make? All right.
Okay.
Yes, Mr. McGowan.
Thank you, Chairwoman. Where did, what facility with our resignations? Was it at one or both or multiple?
We had the food service manager at the Cedars location resign, and then we had a service specialist within the office for the aging position, or within the office for the aging resign.
Oh, all right. Thank you.
All right. Any other comments? Yes.
Thank you, Chairwoman. I just wanted to take one more opportunity to thank our Office for the Aging in cooperation with our health services, as well as, I think, Kinney Drugs and some other community partners a week ago Saturday for doing vaccines for, I believe it was 1,100 plus individuals at SUNY Adirondack. Incredible program. I had an opportunity to be up there to witness most of the afternoon, and just kudos to everyone who was involved with that initiative. Thanks.
Thank you, Ben. I appreciate you making that comment because I know they have worked very hard and worked very well together. At this time, we have, want to see if Don has anything for us on YouTube. You have nothing for us, Don?
Hi, there is no comment right now on YouTube, sorry.
That's all right. Thank you very much. Thank you, Dee. Enjoy the rest of your day. We'll see you next month.
Thank you.
You're welcome. And then we'll move on to Health Services. We have Janelle and I think Ton are both out there. So whenever you're ready, gals.
Good morning, everybody. Can you hear me?
Yes, we can.
All right. So moving right along for our resolution requests, a lot of them are position-oriented. The first one is a request to fill a full-time registered professional health nurse, number 37, grade 19 position, with an annual salary of $47,523. That's an attachment 1. This is due to a resignation. There'll be an anticipated vacancy as of 3/18/2021, and this position's revenue generating based on the nurse's caseload and insurance coverage.
All right. Someone like to make the motion to fill that request?
I'll move it, Peter.
All right, second, Peter. Mr. Conover got ahead of you there on the first. Any discussion on this? All right, all those in favor?
Aye.
All right, thank you. Opposed? Thank you. Okay, Janelle, number 2.
Resolution request number 2 is to request to fill a full-time registered professional nurse, number 31, also grade 19, with an annual salary of $47,523. I'm just looking to extend our intent to fill approval that we had because we have not filled that position yet. Then that position is also revenue generating.
Okay, thank you. Would someone like to make the motion to fill that position?
I'll second the motion after Ron Conover's first.
All right. Thank you. First by Mr. Conover, second by Mr. Stroud. I appreciate that. Any discussion?
Yeah, Madam Chairwoman.
Mr. Conover.
Yeah, Janelle, what, is it, that everybody's looking for nurses, these days because of the COVID, or is there another issue in terms of, the inability to, fill the position, salary, area of employment? Do you have a sense of, that right now?
Well, I think part of it is our intent to use our resources wisely and not to hire nurses that we don't need. Obviously, the pandemic's been very stressful on a lot of people. The resignation that we had related to the first request was due to a resignation with somebody wanting to try something else due to probably the stress of a position and being a new nurse. So I think it's a little bit of everything. It's a little bit of pandemic stress. It's a little bit of home care being a very, very difficult job. And in a pandemic, going into people's houses is very stressful. Even though we have the PPD and the training that we provide the nurses, the wear and tear on our nurses, especially during the winter with the weather and all that, is kind of hard and stressful. In addition, there aren't really a lot of nurses to go around to fill the positions. We try to have some open positions for continual recruitment so that, you know, we can ebb and flow as referrals ebb and flow. If you remember, and actually as I'll report soon, our visits are down. Well, when the elective surgeries are down, then we don't have the business. So we have to ebb and flow and grow as our numbers go up and down. So we always need to be prepared because we are serving the community. And we have to have nurses to be able to cover our patients. So if somebody resigns, we really need a position on deck so that we can get somebody in quickly, should we need to do that.
Thank you.
Thank you. All right, we'll vote on that now. All in favor?
Aye.
Aye.
Opposed? Thank you. Carried.
Resolution request number 3 is basically the same as request number 2, with the exception of it is a full-time registered professional health nurse, position number 32. It's a grade 19 for the same salary of $47,523. It's also revenue generating.
All right, I'd like to make the motion to fill that position.
I'll move it, Edna. It's Peter.
Supervisor McDevitt, second by Supervisor Conover. Any discussion? All right, all those in favor?
Well,
Oh, I'm sorry, do you have a question, Mr. Strauss?
I do, but not related. It's still a yes vote.
Okay, so now go ahead and we'll say we voted, so you can go ahead and speak.
All right, thank you. Janelle, I know the nursing profession, and I know that what I'm seeing for proposed salaries isn't very competitive, knowing what's out there in the market. Is that an issue, do you think?
It's absolutely an issue.
Yeah. So, I mean, I know what nurses make, and you're talking about double that figure, actually. But perhaps one of the reasons why we're getting certified personnel nurses is that that's a low salary for that kind of job.
It is, and I think initially, and I worked at the hospital before I came to public health. Typically, when you're a hospital nurse, you're on shift work. You work every other weekend, every other holiday. When I first came to public health, the home care rotation to cover our patients was once every 12 weeks. We're now every 3 to 4 weeks. So where you used to have the trade-off for the lower salary, that you're Monday through Friday, you work every 3 months, or, and the majority of our nurses came when it was about every 4 or 5 weekends. We're now seeing that every 3, to try to cover our patients. And then with COVID and our clinics and things like that, we're seeing even more frequency. So that trade-off is getting, and then, the benefits through the tiers and the retirement benefits and things like that have also kind of, decreased. So where you used to have a lot more benefits in working in the public sector versus the private, some of those trade-offs are going away and maybe are not as apparent as they are. But, it's wonderful work for those of us that have gotten into it and seem to find the niche, but it certainly is not for everybody. We're just appreciative of people giving it a try when they, when we recruit them.
Edna?
Yes.
Right here.
Oh, go ahead. I'm sorry, Mr. Garrity.
Yeah. I don't know. Janelle, I think you were with us once before. We had to look at this maybe 10 years ago, 11, 12 years ago. We had to look at our salaries for nursing. Maybe it's time to do another study on what we're paying and what benefits we offer to see if there doesn't need to be an adjustment made, because we went through it once before when everybody was after nurses, and I believe most people have to be a registered nurse now, correct, Janelle?
That's correct.
So I think it's time that we revisit this. Maybe the administrator can work with you, and we can look at our salaries and see if they're in line. It does change, and we were having a hard time 10 or 12 years ago, and we made an adjustment upwards. So
Right. I agree with you that, and I do remember I was here at that point when we did have to take a good hard look because we had trouble getting nurses to come. So thank you.
Mm-hmm.
Are we good then? Janelle, can we move on to number 4? Oh, I'm sorry, Mr. Driscoll.
I was just going to add, thank you, Chairwoman. I think it was in the DA's office this past year or so, we did a comparative analysis of salaries in the northeast part of New York or counties that were of similar size to kind of to gauge where they were as far as salaries. And that type of analysis, if we could put that together in the future, might be an effective thing, especially contiguous counties or capital region areas, just to see what they're offering.
Yep, I think it is a good idea. Thank you. All right, Janelle?
Yeah.
Oops, did I miss something? Go ahead.
All right, resolution request number 4 is to fill the full-time registered position. This is a registered professional nurse number 40, grade 19, with the same annual salary. The difference from this position to the others that have been discussed is this is a position on the public health side, fully funded by a ComCare grant that we received from the State Health Department. For a nurse, we're recruiting for that position. We are waiting on a nurse to graduate that has been kind of doing a lot of those duties, but our intent to fill expired.
All right, thank you. Would someone like to make the motion to fill that particular one? Supervisor Conover, second by?
I'll second it. This is Peter.
Yes, thank you, Mr. McDevitt. Any discussion? All right, all those in favor?
Aye.
Aye.
Opposed? Thank you. Carried.
Request for resolution number 5 to request to fill our full-time WIC assistant grade 5 position with an annual salary of $30,520. I'm looking to extend the intent to fill form that was executed in June. At this time, the staff is remote. It's very hard to hire a person. We've been told that when the pandemic is over, WIC will be coming back a month after that. So I just need to be ready to hire when we're able to bring staff back. And this position's 100% funded by the WIC grant.
Very good, thank you. Would someone like to make the motion to move that resolution, please?
Yeah, I'll make that motion, John Stroud.
Supervisor Strauss, thank you. A second to that motion?
I'll second it to Edna. Peter?
Thank you, Mr. McDevitt. Any discussion? All those in favor?
Aye.
Aye.
Thank you. Opposed? All right, carried. We'll move on to number 6.
All right, the last position resolution request, number 6, is the request to fill a part-time not to exceed 20 hours per week for a WIC infant feeding advocate, aka breastfeeding peer counselor position. It's a grade 3 with an annualized salary of $28,026 a year. Again, this is looking to extend the intent to fill form approval that was executed in August. And again, the staff's remote, so we're looking to bring this person on once they're not remote.
All right, thank you. We need a motion to fill that position.
I'll make the motion.
All right, Supervisor Conover, seconded by
I'll second, John Stroud.
Rao. Any discussion? All right, all those in favor?
Aye.
Aye.
Opposed? Carried. Thank you.
I thank you for all that. Moving on to request resolution number 7, I'm going to turn it over to Ton Driscoll, our fiscal manager.
Okay, number 7 is basically moving $5,120 for health and dental insurance. We have an employee who's working in 2 programs, and when payroll is done and separated between the 2 hours, her hours, we need to move the health and dental to the family health program. Her primary salary is in the preschool program, so we're just moving it from preschool over to family health for dental and health insurance.
All right, would someone like to make that motion to approve resolution 7?
I will.
All right, Supervisor Conover, second.
I'll second it to Peter.
All right, thank you, Mr. McDevitt. All those in favor?
Aye.
Opposed? Carried. I'm assuming everybody said yes. I didn't hear them all. I'm assuming.
Yeah.
All right, thank you. All right, resolution number 8.
That's attachment number 8, which is for our early intervention grant that began October 1st of 2020 and September of 2021. We got an increase, which I was surprised, but it went from $24,644 to $30,691 that we can utilize this year. So I just have to amend the budget by that $6,047 difference, and I include where we'd like to have those expenses.
Okay, very good. Thank you. Would someone like to make that motion to approve that request? Supervisor Conover, seconded by Supervisor Strauss. Any discussion? All right, all those in favor?
Aye.
Aye.
Opposed? Carried. Thank you.
Attachment number 9 is our financials that were as of March 10th when I printed these. We have not closed our February for our home care. We're in the process of doing that, so it does reflect only the January booking for revenues. Of course, we haven't had clinics, so there's no revenues there. And our salaries reflect, of course, a lot of COVID activity. You'll see that in regular salaries we're under, and a lot of that reason is due to the fact that we have the nursing positions available. But you do see the overtime and the part-time, which is where most of the COVID activities have happened. And those are definitely over from last year at this time, because, of course, about this time last year, we hadn't officially gotten hit with COVID. So you'll see where a majority of those salaries right now. We do have a COVID grant, which is, we have utilized all of that. That was over $93,000. I just want to bring to your attention. And as Janelle mentioned, we have the ComCare grant, which we're still utilizing our contact tracers only. That can only be used for that grant. I did get a call from Betsy Henkel that she is able to submit some expenses that are regarding the COVID clinics and immunizations only for overtime. So I'm hoping that once this all gets resolved, then we can go and bill for at least the overtime and some other expenses related to the clinic. We can't, at this point that I know of, bill anything for the part-time salaries where we've had to utilize extra nursing staff to help with the vaccinations, but at least the overtime, all overtime, she told me I can claim. So we're hoping at least, and all the vaccinations started at the beginning of this year, so it's all in 2021. So I'm hoping that we'll get some revenue on that from the government and be able to bill that. That's not reflected here yet, of course. Attachment number 10 is our comparison of last year to this year. And again, to remind you, of course, we didn't have COVID hit yet at this point in March 10th of last year. And again, it's just showing you the difference in salaries. Our contractual allowances is primarily just a little delay in invoices with our preschool program where we get a lot of charges each year, and we've already resolved that, and that's already been fixed since this was printed. We were able to get the invoices in from January from a certain vendor, and we're just waiting for their February, which we'll probably get this week. Other than that, that's where we stand.
All right. Any committee members have a question for Ton? All right, we're good on that then. Thank you. Thank you, Ton, for the good job on that report.
Sure.
All right, moving on to the referrals. The reports are included for attachment 11A and 11B that have our CHA activity to date. Our visits, you'll note, are down from January of last year. Again, that has a lot to do with elective surgeries not happening. Anything else you can think of, Ton, with regard to that? I do know that things are starting to hop now. We're seeing an increase in referrals this month. I think we had 3 or 4 over the weekend. Also attached is our emergency response and preparedness report. That reflects our activity, mostly being COVID, and all the clinics that we're doing and outreach and education. And then we have our rabies report also attached. That includes our bite reports for the month. With all the COVID, we're still doing our core functions of public health, which include following up on animal bites. And you can see we had 11 in February. We tested 2 specimens in February that were thought to have rabies. And we've approved 1 person for post-exposure treatment. I do not believe there were any pending items.
No? Okay.
I can move on to my COVID report if you like.
Yes, that would be great. Thank you.
So just kind of a summary to date, and I continue to be amazed and staggered by these numbers. Our total cases to date have been 2,908, and we've had 2,726 recoveries. Of those cases, 224 have been in skilled nursing facilities in our nursing homes. 13 have been in our assisted living. 2,451 have been in the community, which are community-acquired cases. 220 are associated with schools. Just to clarify, that number isn't necessarily exposure at a school. It is, cases that we've had to do contact investigations in the schools. We've been very good with identifying people at risk and getting the right people quarantined without quarantining people unnecessarily. I think that's worked very well, and we've seen very, very little transmission within our schools. We've had 6 hospitalizations right now, and we've had 66 deaths. Hopefully that number will not increase as we end the pandemic. With quarantines, we currently have 261 people in quarantine. that would mean 4,888 total to date that we've had in quarantine. Those are people that have COVID that have been isolated, or people that have been exposures that we've had to quarantine as a result of their exposure. For precautionary quarantines, we currently have 0, yay, and to date we've had 900. Those are people that have been allowed to work under certain restrictions because of their exposure and their essential work. For travelers, we currently are following 29 people. To date, we've received 3,915 referrals of travelers that have come to our area that have all received phone calls. As far as quarantines, that's 2,636. As I've said previously, a lot of those referrals, by the time we call them, and we do call them the same day that we get them, sometimes there's glitches in dates where maybe they were only here for a weekend, so they're already on the train back or the plane back or, you know, wherever, because they were only here for less than 24 hours or 24 hours or whatever. So as far as quarantines and phone calls and things like that, we've done 8,424 have actually been quarantines that we've monitored, managed, visits, and made phone calls. That's a lot. It's staggering. As far as tests, we're still doing our testing trailer. I'm holding out even though business is getting slower and slower, just because we're hearing that, you know, this variant strain is, you know, coming our way. We want to be prepared, and we need to have the testing resources available should that become an issue in our community. To date, from our testing trailer, which we started April 9th of last year, 4,363 swabs we've done for the 5 counties. 2,518 of those have been Warren County. Of the 4,363, there's been 309 positive, which is about 7.8%. Or 7.08% positivity rate in general for the 5 counties. For Warren County, we've seen 157 positives come out of that trailer, which is 6.24% positivity rate of those Warren County residents that have been tested. It's been great effort. Initially, it started out a collaborative scenario with the 5 counties and Glens Falls Hospital. Currently, we're still collaborating with those counties in the hospital. But it's really been a wonderful resource for our community to have the ability to test people that don't have a doctor, don't have insurance, or can't get tested, or can't get an appointment. It gives us good information. We're doing well with the vaccination program. We're finally able to help our seniors. Our seniors have had a lot of good things happen to them in the last month since I reported to you the last time. The pharmacies are seeing more vaccine. Public health is now able to vaccinate our seniors. Office of the Aging had their clinic for over 1,000 individuals. We actually were able to deplete or at least contact everybody on Dee's waiting list that she set up with all the clinic availability spots. So we're very excited about that. We've been able to serve the homebound. We received 400 doses initially that we were able to do a couple weeks ago. Last week, we received another 100 doses that we are working on. We've got 10 of those doses left, and those visits are going to be done by Glens Falls Fire. They're waiting on an approval letter from the state. They were going to do it on Friday, and then the state decided they needed certification. So they're expediting that so that we can get the visits done hopefully today. The state site is up and running at Sears, as you all know. I am very appreciative of our state partners for bringing that. Again, it's a collaborative resource with neighboring counties and our regions, so what a great resource to have. So that's up and running. And then we have our public health clinics. We're starting, instead of getting 100 doses a week or 200 doses a week, now we're starting to see about 500 doses a week. Our staff continue to do case investigations. We're running the testing trailer. We're doing the vaccination, the daily calls, the monitoring of the travelers. One thing to note, as of April 1st, I shudder to say we're not going to have to do the travel quarantines after that, but I still would caution anybody listening or anybody to tell their friends and family, if people are traveling, they still need to monitor for symptoms. They still need to protect themselves. They need to wear their masks. They need to be 6 feet away from other people and just watch their exposures, because spring break is coming. Everybody's going to be traveling for that spring break, and then they're going to be coming back to our schools and our workplaces and creating a hazard. Even though you officially don't have to quarantine, I think people should unofficially monitor for symptoms and keep their family safe and their friends, their coworkers safe as well. I'd like to send a shout out to all of our health services staff, staff from other departments, the Board of Supervisors, Ryan, the Administrator's Office, Don Lehman, everybody, the Office of the Aging, Sheriff's Office, County Attorney's Office. This has really taken a community. We're still not over with COVID yet, but it's just nice to see how everybody has stretched and tried to help fill gaps as we've gone through this. With vaccination, our goal is still 100%, or at least that's my goal. I love my sticker. Another plug for that sticker. I want to thank everybody that's been vaccinated. I want to thank everybody that's got appointments, that's waiting for their vaccination. I want to thank for those that are patiently waiting for appointments, and thank everybody for contemplating whether to get the vaccine or not, and I would encourage you to do so. I'm also asking people that once you're vaccinated, you still need to remain vigilant. While hopefully the end of this pandemic is near, we still can't let our guard down. Even if you're vaccinated, I'm asking people to continue with precautions till the last person's vaccinated. We're all in this together. We're all going to get through this together. It takes a community. I'm very proud to be a part of our community here, and I thank the community for their efforts.
Well, Janelle, we certainly thank you for all of your efforts. When I get a telephone call on a Sunday afternoon from Janelle, I think, what is she doing down there working on a Sunday afternoon when the rest of us are home kind of doing your own thing? So just so you know, everything that you and your department have done, we all appreciate. And I know my committee feels the same way. Ron?
Yeah, I just want to give Janelle a shout out on and everyone involved on the quick response to the homebound, especially, as you know, in our part of the country with winter and all of that, it's exceedingly difficult for a lot of people, if impossible, to get out of their homes. And I think the response since our last conversation on this, I think it was a month ago or so, has been terrific. And the utilization of your partners, the EMS and all that, it's just been a terrific response. And the identification of the homebound, which isn't always an easy thing to do as well. So just kudos to you and everyone that are reaching out to the homebound in our county. Thank you.
Yes, I appreciate you making that comment, Ron, because I had people in my town that were very appreciative of the fact that they went to their house to give them the shot. They just thought that was super. So anyone else have any comment? Supervisor Strauss.
Well, thank you, Chairwoman Frazier. Yeah, Janelle, I think you need a 6-month vacation. I vote to give you that once this is over. And what you've done is above and beyond the cost of duty. But again, if you ever need the town facilities again, we'll do what we can and make it available to you. And we were very glad to help out with that. So.
All right, thank you. Anyone else on the committee? All right, with that, I'll check with Mr. Lehman to see if he has any comments.
Hello, Supervisor Frazier. There are no public comments right now.
Okay, thank you very much, Mr. Lehman. So with that, I will entertain a motion to adjourn. Supervisor Conover, seconded by Supervisor Strauss. All those in favor?
Aye.
Aye.
Thank you. Enjoy the rest of your day.